Good evening, folks. Thank you very much for tuning to our channel. Visit our website supertestscores.com. Supertestscores.com. When I came to United States with the sole purpose of becoming a physician, I was going all over the place and asking people for direction. One of my friends told me that I should take a Kaplan course. But I asked him the price. He said it's like $10,000. So I was so depressed because I did not have that much money. In fact, I did not even have $1,000. So, how to become a doctor without spending much money in America? That was the question I had. So I sat down and I wrote high yield material that is useful to study for USMLE. The notes I prepared helped me to pass USMLE with a very good score and to get into residency of my dreams and settle as a doctor in America. Now, if you are preparing for USMLE, I think you should also follow the same path, not wasting your precious dollars on expensive courses, but studying high yield material. Okay. At supertestscores.com, you can get like over 1,200 questions as of now for only $10. So just spend $10 and get access to these MCQs written like USMLE questions. 1,200 questions for just $10. And the only material I prepared for myself is available for you. So today's question is, let me read it. A 45-year-old woman presents to the clinic with a 3-month history of progressive difficulty performing daily activities such as rising from a chair, climbing stairs, and combing her hair. She also reports generalized fatigue and mild joint pain, which she initially attributed to overexertion. However, her symptoms have worsened over time, prompting her to seek medical attention. On physical examination, the physician notes bilateral proximal muscle weakness, particularly in the shoulder and hip girdles. The patient's sensory examination is normal, with no deficits in touch, pain, or vibration. Notably, the physician observes a violaceous purplish rash on her eyelids and scaly erythematous patches over her knuckles. Laboratory testing reveals elevated creatine kinase. Additionally, the patient tests positive for antihistamine tRNA synthetase, anti-Jovan antibodies. Which of the following is the most likely diagnosis? A. Polymyositis. B. Myasthenia gravis. C. Lambert-Eaton myasthenic syndrome. D. Guillain-Barré syndrome. E. Dermatomyositis. So, the patient case is, we have a woman, she's having some difficulty like raising from her chair or combing her hair. So she has proximal muscle weakness. She also has rash. So that rash is called heliotrope rash. Then she has like scaly patches on her fingers. These are called Gottron's papils. So add proximal muscle weakness plus heliotrope rash plus Gottron papils plus anti-Jo antibodies and elevated creatine kinase. What do you get? That's the super formula for dermatomyositis. So the correct answer here is dermatomyositis. Okay. Why not other choices? Look at the other choices. Polymyositis. Polymyositis is incorrect because patients with polymyositis do not have any rash. They just have proximal muscle weakness. Then why not myasthenia gravis? Myasthenia gravis, patients become tired with working, okay, but they improve with rest. That's not proximal muscle weakness. And also myasthenia gravis does not present with any rash. Then Lambert-Eaton myasthenic syndrome. That is also incorrect because this usually seen in patients with small cell lung cancer, and also these patients also will not possess any rash. Then Guillain-Barré syndrome. Guillain-Barré syndrome is like ascending paralysis. You say they have this ascending paralysis. That means like the weakness starts distally and it goes proximally. And sometimes patients can have diaphragmatic paralysis and respiratory failure. That's a very common thing in patients with Guillain-Barré syndrome. You need to ventilate them, but you do not see any rash. So that is also an incorrect answer. So the correct answer is dermatomyositis, based on a combination of proximal muscle weakness, characteristic skin findings, heliotrope rash and Gottron's papules, elevated CK, and positive anti-Jo1 antibodies. So as you see in this question, when you read through, you need to look for those keywords. Patient has proximal muscle weakness. She has a rash. She has Gottron's papules. So those three themselves help you to clinch the diagnosis as dermatomyositis. So that is how you arrive at the answer and get a high score. Okay. So we have these kind of questions, thousands of questions on our website. So please visit our website supertestscores.com and get the USMLE Step 2 question bank is available right now. USMLE Step 1 will be available this summer. So please check our website, and if you have any questions, please leave your comments. And thank you very much. I wish you all the best in your USMLE or NEET exams. Thank you.